you have to understand this. It's really important because this is how, if we're not all raising our voice about this, we're going to be misled. So let me explain this one piece, the public option. And it has a number of brand names these days. So I'm calling it the public option. It's also almost identical with the phrase Medicare buy-in, which has now brand names in Congress. There are variations on this: Medicare Extra, Medicare for America, Medicare X, Medicare, I don't know, there's like 6 or 7 of these that all have at their core a public option, and then some have some actually, frankly, better features than others, but they all have this as their core strategy. So let me explain what a public option is, because all y'all need to understand it. And when politicians say that they're running for Medicare for all, you need to figure out if they really mean this, because this is quite different. So what is a public option? It's basically, give it a price. If Medicare is such a great idea, doc, well, let us just price it, put it on the market, have a premium rate for it, put it on the market, and if it's such a great idea, let the hidden hand of the free market work, and Medicare will take off. Everybody will buy that, and Cignas of the world will just disappear, and the free market will have raised its one-fingered hand again and solved the problem. So let Americans under 65 buy into Medicare is the concept there. Some plans would also say employers could switch from offering private insurance to Medicare, and it's basically a free market concept. And if you're a free market person, that has inherent appeal. And the other idea about it is that it would be less abrupt. It's more of a transition project, and we could get there without as much political capital. And that logic depends on nobody in this room telling anyone in the insurance industry, we're doing this because we want to get to Medicare for all. So don't let them know that, right? That's the strategy. So it sounds tempting, and actually a few years ago I would have maybe supported it until I learned more about it, which is that there's another side to this story. The first thing is that you miss most of the savings. You're just adding another insurance company, Medicare in this case, to the marketplace. So those giant red 18% bars of scary overhead, that doesn't go away. If anything, the system is now one notch more complicated. So it misses, most of these plans miss most or all of the savings. It's not going to draw in a lot of the uninsured. The uninsured are uninsured today largely because they've made the decision that healthcare is just too darned expensive, and it's not a good buy for them. And so we would just have one more option that probably wouldn't be all that much cheaper. So we'd still be left probably with tens of millions of uninsured, which is, of course, one of our bigger problems. It would mainly create a high-risk pool, which would become increasingly expensive. It wouldn't do anything for the people that today have $6,000 and $12,000 deductibles, and that's pretty common. It wouldn't do anything for them. It wouldn't really improve Medicare. It wouldn't mean Medicare now has dental benefits. It wouldn't really do anything. And more importantly, if we let Congress make this the fight, oh, we want Medicare for all, but we think the way to get there is through a public option. If we let that become the fight, it's going to take 3-5 years before we get the public option, right? That's not going to happen quickly. It's going to take a change of Congress, and it's going to take 3 to 5 years before we accomplish this step. And then you try to talk about healthcare reform or Medicare for all with people 5 years from now when this thing passes, they'll look at you here. They won't make eye contact because they'll be saying, oh, I'm really worn out. I'm really worn out. Let's give this 3 to 5 years to work and see how well it works. In other words, this would probably delay Medicare for all and single payer by 5 to 10 years if we let this become the fight. So it's incredibly important when you hear people running for office saying, I'm for Medicare for all, and I think the way to get there is through a public option or through Medicare Extra or one of these other things. I think the way to get there is through that. You need to go to the town hall and raise some of these concerns about, well, you know, why is that such a great idea? Why don't we just do the right thing that we know most Americans want?